So we'll continue with the Autacoids in the second part. Serotonin basically is made from tryptophan amino acid. We have discussed about this. Now this hydroxylase, tryptophan hydroxylase, converts it into 5-hydroxy tryptophan. Now tryptophan decarboxylase, there is a decarboxylation reaction, okay, and there form the 5-hydroxy tryptamine, okay. So that is known as serotonin, okay. So what happens? Telotrestat is a new drug which is acting on the tryptophan hydroxylase, okay. So what will it do? It will decrease the amount of serotonin because it is not able to break the tryptophan. So this tryptophan will increase, but at the end of the day serotonin will decrease. So which condition will use? Carcinoid syndrome, that is a tumor which produces lots of serotonin, okay. So carcinoid syndrome. Now effect of serotonin, its receptor is 5-HT1-7 GPCRs. All are GPCRs except 5-HT3 which is inotropic, okay. So we have drugs for 5-HT1 to 5-HT4, so we'll discuss one by one. 5-HT1 we have 5-HT1A agonist, 5-HT1BD, 5-HT1F, okay. So all the agonists will learn. In the 5-HT1 agonist, that is buspirone, it is an anti-anxiety drug. 5-HT1B and 1D agonist, these are the triptans or the ergots, okay. They are used in the acute attacks of migraine. 5-HT1F agonist is the lasmiditans, okay. These are under trials for the acute attack of migraine, okay. So these are the three category of the 5-HT1 receptor, the subtypes and the names of the agonist. 5-HT2 we have 5-HT2C agonist and 5-HT2A 2B 2C antagonist, okay. So here is the antagonist is there. Now lorcaserin is an anti-obesity drug. The side effect is the psychosis, but it is approved. It was approved before, but the side effect is psychosis. It has a red label warning, okay. And this antagonist, 5-HT2A 2B 2C antagonist, it is the most important category of drug in the CNS. Is the clozapine, olanzapine. These are antipsychotic drug which has a side effect of obesity, and clozapine has more potential for obesity potential than olanzapine. So clozapine and olanzapine, these are heart of treatment in the psychosis patient, and it's very important to you to understand. Non-selective 5-HT blockers are methysergide, ketanserin, and cyproheptadine. I told you cyproheptadine has multiple ways to act, right? So it is acting on the serotonin syndrome as well as migraine. Now 5-HT3 blockers are the antiemetic drugs like the cetrons. These are the cetrons for the vomiting, okay. So in the brain CTZ area it is present 5-HT3 receptor. Its blocker are the antiemetic, that is the ondansetron, granisetron, tropicentron and palonosetron. These are the 4 cetrons which are used for the as an antiemetic drug, okay. In the GIT the 5-HT3 का बात किया जाए, in the GIT it is antidiarrheal, that is allosetron, that is antidiarrheal. So diarrhea in IBS and female only present, that is in diarrhea, right? So it's very important that all this allosetron is an antidiarrheal drug. It has ending of setron, but it is not an antiemetic, okay. So all these antiemetic, granisetron, ondansetron, these are used in chemotherapy and radiotherapy induced nausea and vomiting, okay, but not in the motion sickness, So this is the vestibular area. This is H1 and M1 is present. So vestibular nerve, we have discussed about this. Vestibular nerve will take this to the CTZ area in the the cerebellum, okay. Now treatment of motion sickness, you will see there is the antihistaminic drug first generation, that is diphenhydramine, cinnarizine, okay, and cyclizine. Cinnarizine has an additional property to block the calcium channel on the vestibular nerve, okay. And hyoscine is present. We have discussed about this. They decrease in the cognition and sedation, and they both are diphenhydramine and hyoscine are present with the post auricular patch to increase the absorption. So oral and post auricular patch. Treatment 30 minutes before journey, we have discussed. sedation साइड इफेक्ट होता है जिसका अगर ट्रीटमेंट बात किया जाए तो हम लोग एफेड्रिन देकर उसको ठीक कर सकते हैं. 5-HT4 agonists are present only on the GIT. It increases the motility, and these are the prokinetic drugs. These are the prokinetic drugs is used in the treatment of constipation, GERD, that is increasing in the gastric motility. It closes the lower esophageal sphincter. Also given in before surgery to reduce the aspiration of the particles, right? Now, so this is important that 5-HT4 agonist is a mnemonic of the, these are the pride drugs. These are the pride drugs: CT-MRP, Cisapride, Mosapride, Rexisapride, Prucalopride. Okay, so these are, now Tegaseroid was also there, but it was banned due to increase in the QT prolongation. Most of the drugs increases the QT interval. These are prokinetic drugs. These are 5-HT4 agonists. These are 5-HT4 agonists. Okay, clear? Now, things to understand is this drug metoclopramide. Metoclopramide is an excellent drug to understand that it is a 5-HT3 agonist, 5-HT4 antagonist, and D2 receptor antagonist. Okay, so ultimately it will be a prokinetic drug, antiemetic drug. Yes, it is both. It has both role. It is a very common drug to understand. It can cross blood-brain barrier, and D2 is present in the basal ganglia, so it will increase the prolactin and it will increase the Parkinson's side effect. So it will increase the muscle tone and Parkinsonism को वो क्या करेगा, increase करेगा. D2 blockers not cross the blood-brain barrier. D2 blockers does not cross the blood-brain barrier. ठीक है, और जैसे एग्जांपल उसका आ जाएगा आपका डोमपेरिडोन. जबकि यहाँ पे D2 ब्लॉकर मैंने बताया था, यहाँ पे मेटोक्लोप्रामाइड जो था, मेटोक्लोप्रामाइड वाज एन एक्सीलेंट D2 ब्लॉकर विथ द 5-HT3 blocking property, 5-HT3 blocking property and 5-HT4 agonist property. D2 blocker as such is the domperidone. It acts on the CTZ area and the GIT. It does not enter the brain, so no Parkinsonism and no prolactin is there. So domperidone is an excellent choice as an antiemetic in the levodopa-induced vomiting. Levodopa-induced vomiting, and also in the GERD. Now, this you have to understand and learn that this is the blood-brain barrier and this is the CTZ area, and here you can see this is the NK1, this is the NK1 receptor, this is the 5-HT3 receptor, this is the CB1 receptor, this is the cannabinoid receptor, which actually decreases the vomiting, right? The serotonin which will increase the vomiting, and substance P which will increase the vomiting. So what are the classifications of drug you will see? What is the classification of drug you will see? Are the these are the basic thing you have to understand, that 5-HT3 blockers are the cetrons. Granisetron or ondansetron, it is used, I have discussed, in the chemo and radio induced nausea, vomiting. NK1 blockers are the pitent, that is apripitent, nitupitent, rolapitent. Apripitent, nitupitent, rolapitent. This is the most effective drug in the CINB and chemotherapy and radiotherapy induced nausea, vomiting. Okay, nausea, vomiting. And there is after 24 hours there is a delayed phase. CB1 agonist, that is the dronabinol and nabilone. These are the add-on drugs. So these will what do? This will increase the appetite in the cachextic patient, in the HIV or cancer. That will increase the appetite. CB1 agonists are the dronabinol or the nabilone, and that will increase the appetite. CB1 antagonist is the rimonabant. It is an anti-obesity drug. It will increase the suicide potential. Corticosteroids, CINB and RNB. Drug of choice are the cetrons or pitent. Cetrons are the early drugs which are given because in the early chemotherapy induced nausea, vomiting or radiotherapy induced nausea, vomiting, cetrons are used, but later after 24 hours, say suppose, pitents are the drug of choice. Okay, pitents are the drug of choice, but corticosteroids will be an add-on drug. So emetic agent in the case of poisoning, that is the injection apomorphine, that is D2 agonist. What are the drugs which are in which they are contraindicated. In which poisoning? These are the kerosene, caustic, corrosive, unconscious patient, opioid poisoning. So this was all about serotonin. We will discuss more about serotonin in migraine. Okay, thank you.